Welcome to State of Wellbeing, a podcast from South Dakota State University. The State of Wellbeing is a holistic well-being podcast with the goal of supporting the campus community as we strive to be a growing, high-performing, and healthy university.
This information is not intended to diagnose or treat anyone. Any concern should be brought up with your provider.
Welcome to State of Wellbeing. I'm Caitlin Walters, Wellbeing Specialist, and joining me today is
April Schneider, Nurse Practitioner at the SDSU Student Health Clinic.
April. If you don't mind, tell us what a nurse practitioner does.
I evaluate and treat patients based on their needs.
And thank you so much for joining me today. Today, I thought we would talk a little bit about summer safety as we head into the summertime. And I wanted to talk a little bit about how it relates to summer safety and our health, because I think there are a lot of things that can come up in the summertime that we just want to be mindful of to try to keep ourselves healthy and safe during the summer. So the first one I want to talk about was heat and hydration. Can you tell us a little bit about what happens to our body in hot, humid conditions?
Humans are designed to try to reduce their body temperature by sweating, and then that evaporates off of the skin and that cools our body down. In high heat or high heat and humidity, our body doesn't actually evaporate the sweat off as well as it should. So we end up with overheating, and then our body's core temperature actually goes up. Our heart rate goes up. We're losing fluids through sweat and through urination, sometimes diarrhea. And so that can actually have a direct impact on the brain and essential organs that run our body.
Can you briefly explain, there's kind of a spectrum when it comes to heat illnesses. Can you briefly kind of walk us through some of the different heat illnesses we might see, maybe kind of starting from that like heat rash or heat cramp, and we'll go all the way up to heat stroke?
Yeah. Heat rash is one of those first things that you're going to see. We see it a lot in little kids. You'll see some kind of red little bumps or even some blisters sometimes. It can happen in skin that overlaps or rubs together in the heat. It can happen in kind of like the waistline or the groin line for underwear or shorts. And it's our signal that our sweat ducts are actually blocked. So we want to kind of wear looser layers for that part. It is just a sign that we need to do something to cool the body down if we're seeing that kind of heat rash. Either we need to have a barrier of clothing or get in from the heat into a cooler environment. After your heat rash, you're going to move on to like heat cramps. So muscles can spasm in the abdomen. They can do it in the legs. They can do it in the arms. They can almost like Charlie horse, as people are used to hearing. And that is caused by a loss of our salt and fluids. So the kind of the salts and our sodium in our body. This often occurs if you're excessively exercising or if you're not replacing the hydration that you're losing. Heat exhaustion, you're going to go through heavy sweating, feeling weak, dizzy, throwing up or having diarrhea, vomiting, headaches, you're turning pale, your skin is kind of cool but yet clammy, and the body temperature can go up, and your body's giving you warning signs at that point. If you don't take those warning signs, you could progress onto heat stroke, which is a medical emergency. Your body temperature can actually get up above 104 degrees Fahrenheit or 40 degrees Celsius. You can be disoriented. When you hear of people being lost in the desert, they're actually getting disoriented. They don't know which direction they're moving on. Slurred speech, kind of in and out of consciousness. Hot skin, which can be either dry or sweaty. And seizures or even a coma in the most severe cases.
How quickly can these heat illnesses develop, during those summer activities, being outside?
It depends on the temperature and that humidity, but it can be within a half an hour. Also depends on the environment. Are you standing on cement? Are you standing on grass? All of those things will have to be factored in. What are you wearing? What are your health conditions underneath? So minutes, maybe hours, depending on the person.
And what role does hydration, sleep, and nutrition play in helping with all of these illnesses?
Hydration will help maintain your blood volume and helps you to be able to cool your body. If you're having some poor sleep, it reduces your actual tolerance to the heat and affects your decision making while you're in that kind of hot environment. Electrolytes in your nutrition, like sodium and potassium, are essential to keep your nerves and your muscles functioning the way that they should.
So I think, those are all really great. What do we do if we experience any of those, or if we're like, I'm like cramping, or I'm noticing maybe some heat exhaustion?
So you obviously need to take a break and get out of the environment and then replace those fluids that you're losing, preferably with an electrolyte solution. If there's an emergency, if you're in that heat stroke, high temperature, those kind of things, you should call 911. You should get to the nearest emergency room. They have rapid infusers that can infuse some fluids for you, get that in there quicker, and intervene the way that is necessary. A lot of labs will need to be done.
Yeah, it's an emergency.
Yeah.
No, I think that's great. And yeah, just like that, getting cool, getting to a cool place, getting out of that hot environment can be really helpful for some of those more minor things. But certainly with those higher level ones, we really want to seek emergency care.
Exactly.
So kind of moving on to the other piece of this is the sun. Why is sun protection important? And why is it more than just avoiding a sunburn?
Well, there are all sorts of effects that can actually happen from the sun. We worry about skin cancer, premature aging for people like me, young females. We also worry about our eyes. Eyes can be damaged from the sunlight. So we want to make sure that we're protecting as much as we can to get the best out of our one body that we get in a lifetime.
I was kind of lecturing a friend the other day because she took a nap, or she was kind of sunbathing and ended up with a sunburn. What are some of the short and long-term risks of that UV exposure, of those burns?
So short-term would be sunburn, heat illness, or irritation to the eyes, kind of feeling like your eyes are dry or gritty. Long-term, you're looking at skin cancers, predisposition to melanomas, basal cell carcinomas, squamous cells. You'll also see that some of the skin will turn over time if they really like the sun and kind of worship it, that they will see kind of a leathery appearance to the skin. And that's dehydration and sun damage kind of combined. Your immune system gets suppressed from the sun. It's just not able to activate, and you can permanently damage your eyesight or your vision from long-term unprotected exposure to the sun.
Yeah, and I think that that's just really important because when I was younger, I certainly wasn't as careful as I should be. And, I notice now, like, parts of my skin that have been exposed for long periods of time over the years certainly look a little bit older, a little bit more weathered. And so I'm much more careful about it now, but I certainly wish that I had been more careful when I was younger. Can we talk a little bit about sunscreen? How often should we be applying it? When should we be applying it? I've heard that you need to wear it even on like cloudy days. Is that true?
You can actually reference the UV rating. So if a UV rating is like 4, 5, I would consider putting it on. If the UV rating is 1, I'd let you choose. Now, for me, I did all the sun damage when I was younger. Do I wear sunscreen every day? I sure do. I put it on every day. Coming to work and sitting inside all day, I'm still wearing sunscreen. While we're out in the sun, though, you're going to for sure want to put that on when that UV index is around 8 or 9. And then depending on sweating or activities, you're going to want to reapply every 180 minutes, typically is what it says on the bottle, which is 2 hours. So kind of gets annoying, but when you look at the long-term effects, you're really doing your body good to protect it.
So I want to move on to the last topic, would just be bugs, maybe plants and environmental risks. Can we talk a little bit about like ticks, mosquitoes, and then poisonous plants?
We have all of those here in South Dakota. So, tick-borne illnesses, Minnesota actually has a pretty high amount of tick-borne illness, Rocky Mountain spotted fever, Lyme's disease, anaplasmosis. So if we can prevent a tick bite that will be a number one. There are other insect-borne illnesses like West Nile. We see that a lot here, and it's not very easy to diagnose. There will be a ton of fevers, 103, 104 fevers that are recurrent over weeks and weeks, some confusions, some memory loss, some nerve damage. And so if we can prevent that by wearing a DEET bug spray, that's my preference. That's recommendation from the American Academy of Pediatrics as well for little ones. And so you're applying that before going out into the environment. And then also trying to avoid those high bug areas or time frames. The time frames for high mosquito tick counts are going to be early morning and late or early evening. So it's kind of the opposite. The sun, you're supposed to stay out of it from like 10 till 4, so you can't go outside ever. Just kidding. You just want to prevent it by wearing long sleeves. Some people will even duct tape their sleeves or their pants to prevent ticks from climbing up their pants. Wearing a long sleeve shirt is also good when you're out in the weeds or doing yard work. When you, say you come across a bug or a tick that's already bitten you and is attached, you'll want to do a very smooth movement of just grabbing the head of the tick right next to the body and pulling straight back. You don't want to do any twisting. You don't want to do pulling on just the body of the tick, or you'll leave the head there. And then you'll kind of monitor for what happens to your skin. You'll wash it, keep an eye on things afterwards. You don't want to see any new rashes showing up. You don't want to see any bullseye signals that appear on that skin where the tick bite was. For mosquitoes, you kind of have to wait and see. You'll get itchy bumps that are annoying, but how do we know if anything was transmitted? It'll take time to see that.
And I'm always, whenever I'm out with people in brushy areas where ticks are maybe more likely to hang out, and also with my dogs, because I've found a lot of ticks on my dogs. I just, every time we end an activity, I fully check myself, and you're checking those like kind of like those places that are like dark and warm, right? And so like maybe where your socks met your skin or where your pants were around your waist, checking those places. Armpits are another really common one, the behind the ears, in your hair, checking your scalp. But they really like to hang out in those like darker spaces. And so just checking those spaces or having someone check them for you, like if you have, a friend or a loved one that can help you. But really giving yourself a good look over, giving your dogs a good look over, your pets, because like I said, I've certainly pulled quite a few off of my pets. But making sure you check out, and doing that as soon as you're done with the activity is really helpful in hopefully preventing them from biting you.
Yes, absolutely.
Anything else you want to add?
So severe weather when it occurs, especially in the summer, our highest weather risk is going to be a tornado. And so knowing where to seek shelter, how do you know when to seek shelter? There are local news outlets that you'll be able to kind of reference. They'll tell you when you're in a thunderstorm warning or tornado watch, which means we're watching for things. Once things gets up to warning, that's time to take action and actually protect yourself. You're wanting to be on the lowest level of a building, inner hallways, away from windows and doors. You want to make sure that you're covering your body. If you have to, pull a mattress off, cover yourself with a mattress, and then waiting until you get an all clear. Don't be a weather watcher. Don't go outside and watch to see what's happening. Protect yourself and those around you.
Yeah, that's such a Midwest thing to be out looking for the weather. And then when it comes to lightning, just being aware when you're out on an activity, is there lightning in the area? If there is, getting to a lightning safe place, getting into that lightning position. You can look all of that up online, what that looks like, but making sure that you're, not standing under tall trees, you're crouched down. You're not sitting on the ground, but you're kind of like squatting on your feet. And if you don't know what lightning position looks like, I would highly recommend it. I had to send my husband a picture because he likes to golf, and he told me that what he was doing for golfing. And I was like, that is not the position you need to be in. So look up lightning position. I highly recommend it if you're going to be out exploring during the summer as well.
The county, Brookings County, actually has a really good website called Be Ready Brookings, and that has information about what you should be looking for, how do you watch for weather. We have weather radios, which most people aren't even aware of anymore, because our phones give us those notifications if we're in severe weather. But it's a good resource to be able to look at and peruse, and if you have questions, you can always let us know.
I think just making sure that we are really good about preventing these summer-related illnesses or injuries is really helpful. And so not telling anybody not to go outside and enjoy the summer weather, but just making sure that you're prepared to do that when you do go out. Have water with you. Make sure that you have the proper clothing, and carrying bug spray is always really helpful, especially if it has DEET in it. But just making sure that when you're going out to do activities outside, you're prepared for them.
Perfect.
Wonderful. Well, thank you for joining me today.
Thanks so much.
Our processing questions for this episode are: what are some different types of heat-related illnesses? And what are some ways that you can protect yourself from tick or mosquito bites?
Thank you for listening to this episode of State of Wellbeing, a podcast from South Dakota State University. This podcast is brought to you by the Mental Wellbeing Team and SD State Health.